Did you know that after menopause, a woman's cardiovascular risk rises sharply, quickly approaching that of their male counterparts of similar age and health profile? This is why today I'm talking about postmenopausal cardiovascular risk. The American College of Cardiology's annual scientific session highlighted a important study in April 2024 that really looked at the risk of heart disease in postmenopausal women. And it involved 579 postmenopausal women who were taking statins, medications to control their cholesterol, with two coronary artery calcium scans taken at least 1 year apart. Participants did not have heart disease at the time of the first scan, and each woman was matched up with a male counterpart of similar age, race, statin use, blood pressure, and diabetes status. A CAC score, or a coronary artery calcium test, also called a heart scan, is a CT scan of your heart done with a multi-detector CT that takes detailed images of your arteries that supply blood flow to the heart muscle. The images show calcium deposits, and those in your coronary arteries can sometimes be associated with more severe disease in the heart arteries. So, measuring that plaque buildup indicates the risk of heart attack or other cardiac events. A higher score corresponds to a higher cardiovascular risk. So, what did the results show when we compared men and women of similar age, race, med use, and health? In women with lower baseline CAC scores, they saw a median increase of 8 points, twice the median increase of 4 points in men. Women with a baseline CAC score that was a little bit higher saw a median increase of 31 points compared to 16 points in men. No significant sex differences were found for those baseline super high calcium score already. So, what's going on here? Postmenopausal women experience a faster rise in plaque buildup than men, indicating a sharp increase in heart disease risk. Now, we already know that heart disease is the number one killer of women, and here we are pinpointing a time in life where that change is rapidly increasing. The accelerated risk is likely linked to the loss of estrogen after menopause, which we know has a protective effect on heart health. We raise awareness all the time to women's cardiovascular risk, but what are we really doing about it? As providers, how are we caring for women at this critical juncture in their life for something that really can have serious implications for not only your health, but your mortality? Women's cardiovascular risk has historically been severely undertreated, partially because women tend to develop heart disease later than men, and they may experience more subtle symptoms. I'd like to think that's the only reason, and not simply just because we're ignoring the health of women in our lives. Women in menopause have often felt as if no one's really paying attention to their needs. And this is a great opportunity as providers and as patients to both provide and ask for this type of care. At this point, the ACC and the AHA recommend considering a heart scan to assess your calcium score when your risk is ambiguous or borderline based on standard risk factors. So, talk to your doctor, assess your cardiovascular risk, both with quiz taking and history taking, as well as the calcium score, and they can then use that information to determine your recommendation for treatment for intermediate risk and asymptomatic patients. Treat the problem before it becomes a serious one. Postmenopausal women should discuss heart disease risk factors with their doctors and consider heart scan to assess their calcium score. More women may benefit from heart scans than currently receive them. And Medication statins alone may not be sufficient to control plaque buildup in postmenopausal women. This article highlights some really important factors that can positively impact your health and the health of other women.